And if we continue about inactivity versus sedentariness, there's a lot of studies about sedentary behavior and it impacts our health. How do you see the interplay of those two? Probably exercising have bigger health impacts, but is a little bit probably more challenging to do for persons than for example breaking up sitting. How should we approach these in a larger scale to improve public health?
Mhm. Well, that's an excellent question. It's a very topical question. It's something we're struggling with in our field right now, for sure. Um, and I think the deliberations of the Physical Activity Guidelines Committee in 2018 in the U.S., considered that very, very carefully. And I think if you read the guidelines and the report, we see that there's been a shift in focus and a shift towards the idea that, the target is 150 to 300 minutes, of moderate activity per week. There's a range, 150 to 300. That's where we see the biggest benefit from all the epidemiology studies and everything else. That's the range we should be aiming for. Mm-hmm. However, you don't need to hit that range to get health benefits. And that has been a major thought shift in these guidelines, is that any activity is good. Even if you can't get to that 150, you're going to get benefits from the activity. So I think that's one message that we need to really perpetuate, that 60 minutes a week is a lot better than zero. So you're not failing if you don't get to 150 minutes. So I think that's an important message. And folding in the sedentary behavior now, again, it's not that we need everybody to stand up for 12 hours a day. It's that we should be replacing as much sedentary behavior with some level of physical activity, whatever that person can handle. We see these new isotemporal substitution analyses people are doing, these compositional data analyses where you take into account, the 24-hour period of the day. And we see that if you replace 30 minutes of sedentary behavior with 30 minutes of light activity, you get a benefit. You get a risk reduction from mortality even. If you replace that 30 minutes of sedentary with moderate activity, you get a further reduction in risk. You replace it with vigorous activity, you get an even greater reduction. So the message is really replacing sedentary behavior with any type of activity is beneficial, for sure. But you get a greater benefit with the more vigorous you can handle. So a typical young adult out there, I think, could really benefit from replacing light activity or sedentary behavior with moderate levels of activity, for sure. But perhaps those that have underlying health conditions, those that are more elderly, those with obesity, they could replace it with light activity and still see a benefit. So I think it's this merging of the sedentary along the continuum of the physical activity spectrum that is where we need to think a little bit more about. Unfortunately, at the time of the guidelines, the last guidelines, we didn't have a lot of data on the benefits of light intensity physical activity. Typically because it was hard to measure prior to the days of accelerometry. It's hard to measure light activity using questionnaires. So there was always a focus on moderate to vigorous. That's what we were measuring. But now I think with the accelerometer data and all that coming out, we're starting to see the benefits of light activity, the benefits of total physical activity on health. So I think it's a very exciting time in our field to see all of the device measured activity and health outcome data. It's pretty exciting to see.
And you authored last year a paper titled "Should we target increased physical activity or less sedentary lifestyle in battle against cardiovascular disease risk development?" So basically quite the same, but this was more about cardiovascular. So what were the main main arguments or findings in the paper?
Yeah, that paper basically summarized what I just said
All
to a
right.
large extent. To a
So
large extent,
yeah.
it's kind of we were given that title. It was an invited review for the journal. We were given that title, and so we did our best to talk about it. And the answer is, you shouldn't target either one. You shouldn't just target sedentary or increased activity. You should do both. And our paper was focused on cardiovascular disease, as you mentioned. However, it really reflects the body of evidence that we know regarding health benefits of activity. A lot of the overall evidence is based on cardiovascular benefit, so it's almost like a mirror. Yeah, so it was basically around that message that our some of my co-authors like Dr. Bob Ross, and I had a lot of discussions around this. That where people can't do 150 minutes a week of moderate activity, we have to have a message for them. You can't just tell them to give up. They have to understand they're going to get health benefits from the activity they are doing.
Yeah. And you mentioned, for example, the isotemporal substitution studies. Is there some new research methods that you are excited about, or which are taking this field further?
Yeah, well, that is certainly one of them. The idea of considering the 24-hour day where we have sleep, sedentary, and activity, and we're trying to understand the interplay between them. So the compositional data analysis as well. There's arguments out there about the benefits of isotemporal versus compositional and whether they're really the same thing, or of course they're a little different in their underlying structures. And I'm not a statistical expert in that area, but I try to follow that literature, and I do understand the idea that a 24-hour day is a closed system for sure. And if you take something away from sedentary, you have to replace it with something else. And we need special statistical models to do that for sure. We can't just use a regular old linear regression and all that. So I'm very excited to see that data come out. It just provides a little bit of a nuanced interpretation of the data overall. But people have to also remember that it's theoretical, right? A lot of those studies are still using cross-sectional data. So it's saying, theoretically, if we replace 30 minutes of activity with 30 minutes of something else, we will see this benefit. It's not as though they went into the study and did an intervention and actually replaced 30 minutes of time. It's theoretical. It's still theoretical. So people need to realize that. It's not like doing a randomized trial where you actually go in and you randomize people to 30 minutes of activity versus 30 minutes of something else. So it's different.
Yeah. And what do you think, what kind of studies are needed? We have studied obesity quite a bit. We understand it quite a bit, but still there's a lot of global problem with the obesity. What kind of studies are needed?
Well, I do think we need now interventions to better understand kind of what we're learning from these compositional analyses. For example, we've done a lot of studies showing sedentary behavior is bad for health. It increases risks of cardiovascular disease, cancer, all-cause mortality. The question is, what is the alternative? What do we tell people to do? There are some messages out there saying, oh, you should get up every so often, every hour get up for 10 minutes, or every 30 minutes get up for 5 minutes, or whatever. There's very little data on that. These are basically expert opinions. We don't have very good, we don't have randomized trials showing that if you get up every 30 minutes and stand up, you're going to see a benefit. We don't have the data. We think it's a good idea. We're starting to develop studies in that regard. But the idea is we need to better understand, if we're going to tell people not to sit as much, what are we going to tell them to do? Are we going to tell them to stand? Well, that's good. We have some studies showing that standing, reduces mortality. But we have a whole body of literature that people who stand all day at work, they have a lot of health problems. They have musculoskeletal problems, problems with back health, all these sorts of things, with varicose veins, in nurses. So maybe it's not a good idea to tell people to stand up all day. Or should we tell them to do 30 minutes of activity? We don't know the message. And that's where the media has come in. And the media took these early studies in epidemiology. We published 2 or 3 papers showing sitting time is related to mortality. And of course, it went all over the internet, all over the media. But still, it was in its infancy. We had 60 years or more of data on physical activity and health before we developed physical activity guidelines.
Yeah.
We had maybe 5 years of data on sedentary behavior and health. And of course, everyone is crying out for guidelines, and the media is going nuts, saying sitting is the new smoking or all this kind of stuff. So they were really jumping the curve there. And I think if you read the literature, you'll see many of the scientists have pushed back on that. You'll see they've pushed back on that and said, hey, we need to take it a little slower here. We need to develop the evidence first. So I think there's some consensus on that. We need a little bit better evidence.
So basically for obesity, you said that we would need interventional studies, but the sedentary behavior research is in its infancy. What kind of studies do you think we need there?
Yeah, again, I think we need to move into interventions now. We need to understand if you take someone who's sitting 8 hours a day at work and you reduce their sitting by 2 hours, what are the health benefits? What are the potential risks of doing that? So I think that's where we need to move, is more in the intervention field, actually conducting sedentary behavior reductions in living humans.
Yeah, and if I go a little bit back for the obesity thing, you found success in this personalized 2-year program, probably quite costly. Was it 40 meetings with the health coach? And so do you see this applicable in real life? How could it be done cost effectively?
Yeah, that's what we're going to study now, is the implementation of this. And we'll be doing cost effectiveness analysis of our intervention now to see how cost effective it is. You're right, it was expensive to have these health coaches in person in the primary care clinic, but it was within the context of a research study. So of course there's a lot of expenses related to that, because you're evaluating it, you're measuring your success or your failure, you have salaries of the investigators and all of that. So when you partition out the science or the study costs versus what the actual intervention cost, that's where we'll see if we have a significant effect. But we feel that moving it into this online platform, it will allow the health coaches to see a lot more patients in a very cost-effective manner and hopefully achieve similar types of results. So right now, there is very limited benefits from our government in terms of reimbursing physicians or other health coaches for obesity treatment. And so that's what we're trying to change. We're trying to get legislation which would allow health coaches to be reimbursed for their efforts. So, of course, it's a big political thing as well as scientific, but we feel there's benefit to the patient. Of course, now, like I said, we have 42% of our population with obesity. Obesity costs the United States $1.4 trillion per year in healthcare costs and lost productivity. So it's not going away. It's not going away. We need to address it.
Yeah. And maybe if we move now to childhood obesity, what's the status in global scale in childhood obesity?
Again, I think it's the trends are lagging behind what we see in adults, but we see, of course, increases in childhood overweight and children with obesity throughout the world. There's been some recent, epidemiological studies looking at that. And, it depends on the region. Of course, we have global trends, but there's different regional variation, and we're trying to understand that a little bit better. Why some regions, such as North America, have such high levels, and other regions as well. So I think it's a matter of looking at the environments in these different areas of the world and seeing what are the drivers there, and see how we can maybe address those drivers of obesity. But certainly, as you know, the United States and other what you call westernized countries are kind of leading the charge in childhood obesity, and so we don't want to do what we've done. We've failed so far in our countries. We want to learn from countries that have been able to maintain at least a lower prevalence, a lower curve for childhood obesity. I think it's going to take a global effort.
And do we have an understanding what's driving the childhood obesity? Is it sedentary time, more sedentary time because there's more screen use? Is it energy dense food, or what is driving it in different countries or different cultural spheres?
Well, the answer is yes. all of that for sure. Certainly, the reductions we've seen in moderate to vigorous physical activity have driven a portion of this. We did conduct a study in 12 different countries with over 7,000 children wearing accelerometers. And in every country, there was a significant association between low, moderate to vigorous activity and the odds of obesity across these 7,000 children. So it was very, very pervasive that was a contributing factor, or at least a correlate. So that has certainly been there. But again, I mentioned earlier just how complex obesity is to understand. So, we knew that kind of the earlier you go in the lifespan, you may have a better potential to prevent obesity. So, we talk about school-aged children, and then the focus was down now on preschoolers and the early child care education centers, and trying to intervene there to reduce screen time and improve nutrition. And then we're going earlier and saying, breastfeeding may be related to obesity and early childhood nutrition. Oh, but wait a minute, we go back now and look at the mother. And during pregnancy, we see that weight gain during pregnancy and obesity during pregnancy is affecting offspring, and they have a higher risk of becoming obese. Oh, but wait a minute. Now we have some studies showing that pre-pregnancy lifestyle may be impacting the next generation. And so we actually have a study going on here now. It's a study in preconception. So it's a study to improve physical activity levels in women before they get pregnant, to look at the effects on the next generation. So when I say that it's a complex problem now, I mean, these are just some layers. But within each of those layers, there's a huge amount of research to be done. So we're going back now to the prior generation and improving physical activity of women before they're even pregnant, and hoping that will have an impact on the next generation.
Yeah.
So, it takes this idea to the extreme of, intervening earlier and earlier in the life course.
And is that via epigenetics, or is there also some other factors in the play?
Yep. Certainly, we have animal models showing epigenetic effects, but of course, there's other issues as well. I mean, just the fact that, a mother who is more physically active before she becomes pregnant has a healthier, environment, like internal environment in terms of biology. People who are physically active are healthier. So it would seem to me that a woman who becomes pregnant and she is physically active and has good nutrition, she has a very healthier environment for her child, her fetus, to grow right off the bat. Because even when you do an intervention in pregnant mothers, they've already got that biology. Even if you start in the second trimester, you have a whole trimester there where the child has been exposed to that environment. And you try to turn it around by providing exercise or nutrition in the later half of pregnancy, but maybe it's too late. Maybe it's too late by then.
Yeah, really interesting findings. And if I ask about this project, you've been leading this international study of childhood obesity, lifestyle, and the environment. Could you tell a little bit of that project and what you have learned doing it?
Yeah, this was it was done years ago. I think it was 2014. It may have ended, if I remember correctly. But this was a dream I've had for years and years to maybe, better understand the global. I'm not going to say determinants, but I'll say the global kind of correlates of obesity in children. So we amassed a group of researchers from 12 different countries and developed a protocol. We all got together here in Louisiana, developed a protocol for the study in which we would take 10-year-old children from all of these 12 countries and do a study where we measure physical activity using an accelerometer. We would try to measure diet the best we could using the best available type of questionnaires for 10-year-olds, which of course is still very difficult. And of course we had information on the environment. So getting back to that environmental factor. So we studied the schools, we audited the school environment, we did questionnaires for the parents about their neighborhood environment. And so we tried to capture a bunch of levels of influence there. And essentially it was a cross-sectional study. So we just measured the kids once. But we were able to get, like I mentioned, over 7,000 children engaged in the study and providing data. So we had a lot of insights from the study. We've published over 100 papers from ISCOLE with all these people. But aside from the science, to me, this was a great international collaboration because we had over 200 people working on the study in various capacities, from investigators to research coordinators to graduate students to undergraduate students. And so it was a big effort, and it contributed to research development in both I'd say higher income countries and the lower income countries. We learned from each other about doing research in these different environments, and we also engaged many graduate students who wrote their thesis on this on the data set. So from a research development angle, in terms of kind of doing a standard protocol around the world where people are still using that protocol, they keep calling me and saying, oh, could we use this questionnaire from ISCOLE? Could we do this? Could we do that? So I'm very excited to see that hopefully this study, beside the findings from the study, that it'll have some legacy for the next generation of researchers. So we were very excited to participate in that study.
So it's not easy to collect like data in one city from 100 children, and you did it in many different countries from 7,000. What were the learnings coordinating this and getting everybody trained, getting the data, all the complexities? What did you learn?
Yeah, it was very complex. We did regional trainings. We brought several of we brought the lead investigators from each country together and trained them on the protocol and the measurements. And we also brought several of their staff members and we trained them. We also then tested them. We had online testing where they had to be proficient in doing the measurements and understand the background of the measurement and all this. So essentially everyone in the study around the world who measured waist circumference we know they did it following our protocol, and they were certified to take that measurement. So it wasn't as though we just went to a school and had students measuring each other, whatever. We had highly trained personnel all around the world because of our training program. So we spent a lot of effort in the early years training. So we had manuals of procedures with photos. We had videos developed where they had to watch a video of someone getting their waist circumference measured or their height or their weight. So it was a very standardized protocol of training. And, from there, that's one of the key things, I think, in a multi-country study is the standardization of the protocol. And so I think that's what we instilled in many of the researchers was the rigor of the scientific method. And so that's what I learned was that really held the study together.
Yeah, so we are running out of time soon. So one more question for young researchers: how to build a research career? What's your main points? How to do successful research career?
Well, that's a great question. Everyone has a different path in their research career, and not everyone will end up at the same place. And we probably don't have time to get into it now, but certainly there are different career paths to get to where you want to be. And so I think for the younger investigators, some good advice is really just to follow up any opportunities you can to collaborate with others. We need to take advantage of opportunities as they present themselves, and look for mentors where you can. The mentoring of junior investigators, I think, is extremely important in our field. And you have traditional mentors, such as your PhD advisor, but you can look for other mentors in the field as well to help you with different aspects of your career. So I think surrounding yourself with good mentors and taking advantage of every situation and reaching out for collaboration, I think that's key to success.
Yeah. So you have a next meeting coming up, so I will finish here. Thanks a lot. It was super interesting discussions. Thanks for taking the time for this podcast.
Absolutely, Ollie. Thank you for having me.